So that is actually a great question, and I would echo that concern, especially in women's health. I feel like physicians many times feel like they know they need to quote unquote market themselves, particularly if they're in private practice or they've got their hand in maybe a little bit of concierge medicine in addition to insurance-based medicine. But I don't think any patient really wants to feel like their doctor is selling them stuff or trying to push things on them. I try to put myself in the position of the patient. I myself am a woman that goes to a gynecologist and I think about things and, how would that resonate with me? If I got an email from my physician, how would I feel about that? Or if I watched a webinar, what would be topics that would resonate with me? And so I think the biggest thing is that really don't even think of it as marketing. Just think of it as whoever is the best at educating their patients, their existing patients, as well as their community. You will authentically be good at marketing and you're going to be able to do it in a way that feels authentic to you. Because at the end of the day, right, we're clinicians, but we're also educators. And so things like keeping in mind nowadays, so that there's been a big shift in how patients are going about finding and choosing a provider and how they're going about finding and just even researching their own health conditions. So it's important that you're not just ignoring marketing. You need to think about, how can I craft my messages on my website or on my social media to be able to get picked up on Google and nowadays AI tools, right? Because people are using ChatGPT to Google their symptoms and do research on what different treatment options are. And then also your reviews. So a lot of times I think providers forget that reviews are actually a part of marketing and it's something that all consumers look at reviews, whether they're buying something on Amazon, and certainly if they're going to change physicians, they're going to look at your reviews. So, again, I think all of this really comes down to put yourself in the patient's shoes. Don't think of it as marketing. Think of it as, I have a message that my community needs to know, and here's the ways that I'm going to make sure that those messages get found. I definitely don't think you need to hire a marketing team to come up with who your ideal patient is. I think at the end of the day, you need to first think about what makes your practice different. So, is there a certain specialty that you really enjoy treating or serving? So, for example, maybe your practice, you've had it for a long time and your patients have kind of grown with you and you used to deliver all of their babies and now you're treating them for menopause. So in that context, right, you want to make sure that your graphics and your topics and everything are geared towards speaking to that particular person. You can also look at like what are the procedures that you enjoy doing the most. If you got up every day and you really enjoyed doing minimally invasive hysteroscopic surgery, well, then maybe you need to target women that, have postmenopausal bleeding or they have fibroids or things like that. And then the other thing is just thinking about the procedures that you offer and what are the procedures or treatments that get the highest patient satisfaction, like the things that you feel like you can make the biggest impact on a woman's life. And then I think you just sort of reverse engineer who is the ideal patient from there. Because at the end of the day, right, we want to enjoy what we're doing, but we also want to be able to reach the people that need it the most. And so when you're thinking about that, again, is it that menopausal patient? Is it the woman that is younger and is thinking about her fertility and has concerns about that? Or maybe it is the person that really wants a minimally invasive procedure versus an open procedure, and maybe your practice specializes in those sorts of things. And then you're just looking for common characteristics of those people. So obviously, I'm kind of the menopausal woman. So, you're looking at a 45 to 55-year-old woman. Maybe you offer some cash services. So you want me to be in, the top 50% income bracket in my area. You're targeting a woman that, wants to exercise and I've got a Peloton bike and I like to shop at Whole Foods, so you can really kind of fine tune it from there. And then your messages will resonate much more with that person. Because if your ideal patient is every woman 18 to 80, your message, well, yes, you can treat all those people. Your message to an 18-year-old is going to be very different than a message that's going to resonate with a middle-aged person. So I would really just think about what are the things you enjoy doing? What does your current waiting room kind of look like? Who are the favorite patients that you love seeing every single year, and how can you find more of them?